Aloha kako. Welcome and good evening. My name is James Eustace, and I'm the president of the Waimea Community Association. Thank you to those joining us online tonight for our regular monthly town meeting. Tonight, we'll be hearing important updates and discussing issues relating to the challenges our community faces during this time. We are grateful to be joined by representatives and leaders of our state, of our county, and our community this evening. I encourage you to follow, like, and subscribe to the Waimea Community Association on our Facebook page. You can follow us on Instagram or even on YouTube. You may also find relevant information and resources on our website at waimeatown.org. We strive to keep our accounts active and up to date. At this point, I would like to recognize the WCA board members, our Vice President, Michael Donnelly, our Treasurer, Jeremy Madrid, our Secretary, Nancy Carr Smith, and our directors, Frankie Pang, Riley Smith, Lani Olsen Chong, David Greenwell, and Patty Cook. On behalf of the Waimea Community Association Board, we are grateful for the support shown by you, the community, to hold virtual town meetings during this time. And much like last year, we will continue to hold virtual town meetings in this setting, with our aim to provide you a connection to community leaders and an opportunity to learn about important and relevant information. Thank you all for your interest in joining us for our past meetings and for viewing and sharing the recordings. You are welcome to revisit and rewatch these videos up on our WCA Facebook page or our YouTube channel. The Waimea Community Association is a nonprofit organization that strives to promote open participation by all of the Waimea community, develop leadership, and support the smart growth of the region. If you'd like to support the work that we have done and help continue our effort in connecting with our community, you're more than welcome to donate or join as a member. If this is something that interests you and you'd like to receive more information, please email us at waimeacommunityassociation@gmail.com or visit our website at waimeatown.org. And on our website, you will even find an option to contribute and join digitally. Or you're welcome to mail us a form that you can find on our website if you prefer. Your contributions and your membership allow us to reach out and connect with the community in this setting and support the work that the WCA has done over the past 60 years. Mahalo for your contributions and support. So for this evening, and as mentioned on per our agenda, as you may have seen, tonight we'll be hearing some important updates from community leaders and our elected officials. We will begin this evening with a conversation with our Lieutenant Governor, Josh Green. We will then have an opportunity to learn about a couple of community updates here in Waimea, including a community policing report, an update from our South Kuala District Police Captain, Sherry Bird, and Community Policing Officer, Aaron Kaeo. Following these community announcements, we will hear from our February nonprofit spotlight, Hamakua-Kohala Health. We will then have an opportunity to learn more about our government response and ongoing procedures carried out by Hawaiʻi County and from our very own hospital here in Waimea. This evening, we are grateful to present you with a full and an informative agenda. And after we hear from these officials, we have allocated some time for your questions, your community questions, to share with our presenters. We appreciate community members that have taken the time to send us questions ahead of time. We will also try and capture your questions from the live feed on Facebook. Please use the chat to pose your questions, and we will do our best to capture them and share them with our guests this evening. I also want to thank our WCA board members joining me tonight. We have Lani Olsen Chong and Nancy Carr Smith to help me facilitate and ask these questions to our guests this evening. So at this point, it is my honor and privilege to welcome our first guest, Lieutenant Governor Josh Green, to discuss with us and share with us the state's ongoing approach to COVID-19 and the challenges therein. So thank you, Lieutenant Governor. Josh, welcome. Thank you so much. The floor is yours.
Thank you, James. Good to see you guys. Feel like I'm back home. In fact, I'm going to be home on Saturday, Sunday to be on call up in Kohala. So I'll see you, hopefully not there if you're sick, just come and hang out. But it's very good to be reunited. I'm going to do a quick PowerPoint just to roll through some of the hot points, I guess, the highlights that are going on right now with the COVID crisis and the vaccination, if that's okay, James. So let me share my screen if you don't mind, and I'll get that 1 second. All right, hold on a second. Forgive me. There we go. Okay, so here we are, the week of January 24th to the 30th, and I'm going to go through this pretty briskly because I'd rather get to questions. I think that there may be many specific questions about the vaccination program, which is revving up in a very accelerated fashion, I'm happy to report. But this is where we are. The last week, we remain lowest in the country, very low with infections and infectious rate of the disease. It's important to note that, and you can see how we compare to a lot of other states. It's still really crushing a lot of states, Arizona, South Carolina, New York, and so on. This is important because this is the backdrop by making some of the decisions on vaccinating individuals, and it makes it a lot easier. People have really sacrificed a lot to stay safe, and that makes it easy for us to roll out the vaccines. Just punchline here is we've done 181,704 shots as of yesterday evening, and I'm sure that we're over 190,000 by today. So we'll dive into that in a minute. Here's for the entirety of the COVID crisis from March 7th through January 30th. You can see our infection rate is second lowest only to Vermont. And Vermont will, it's very rural and very small. Otherwise, we would, I'm sure, be lowest. And you can see once again, we're faring well versus the rest of the nation. Here is where we fare as far as mortality. Again, we're second lowest for mortality rate. And I will say this, we adjusted our numbers by 60 last week after a thorough review of all of what's gone on for anyone who passed away and may have had COVID in the immediate month beforehand. So some of those deaths were catch up based on coroner's reports. And I know it's a little bit morbid, but I share that just because I want you to know that we're trying to be as accurate as possible to see what we're really dealing with. But we remain second lowest, which is testament to our healthcare providers. I'm really proud of them. As you know, this statewide overview, we have to continue to do the smart things, which is wear our masks, wash our hands, and distance. What it's done is it's actually eliminated the flu and cold season. It's kind of amazing, and our numbers are great there. It's been very helpful, but also it's kept our numbers very low. Our masking rate is better than anyone else in the country, as far as I can tell. We are definitely tracing cases rigorously, and our healthcare system was only taxed to the brink at the end of August. Around August 26th, we had 318 people in the hospital, and we had no ICU beds. We had actually 10 ICU beds left available. It got really scary, but we're now down at 55 people in the hospital. So you can imagine, we're down sixfold, and it's a good thing. Our Safe Travels Hawaii program has worked. Starting October 15th, we began to have people travel here, and as you know, and we've had now 1.186 million travelers screened. 88% have been exempt. I'll go through those numbers, and 830,000 were visitors. The rest were we residents. And we've had almost no cases of COVID from visitors. We as returning residents actually have had a few cases, but again, it's been very small. And on Big Island, things have been more professional than anywhere else because you've also been testing on arrival. It's very effective. And then we're going to get into the distribution plan of the vaccine. There's where we are as far as mask wearing goes with our survey from last week. Maui has upped its game to 96% right now, and people in Hawaii County are just doing spectacularly well. Maui has had to emphasize this in the last week because they've had a bit of a surge, which is now also dropping off. Kauai is able to survive at a lower rate because they really do have very few travelers there right now, and that'll always be important to know. But statewide at 86%, we're doing quite well. Let's look at the impacts really quickly. I've mentioned this once before. We've had an increase of 50,000 individuals going into Medicaid because of the economic impact from 300,000 to 300. So it's essentially a little over 1 out of every 4 of our people in the state. And it's had a huge mental health impact. 43% of our residents have felt lonely, pessimistic about the future, or overwhelmed. And that means lots of extra calls for other organizations. This is one of the important things to mention. Also, domestic violence has been on the rise. These are these are some of the relatively silent but tragic collateral impacts of COVID. Definitely isolation is a problem, and it's why we have to balance opening up and moving forward with our safety. Food insecurity grew very significantly. 1 in 5 people are food insecure, and that means that a lot of great work from Food Basket and others has been totally critical to our survival for people who are hurting. Now, just for comparison, so you understand where we were, right after the surge of Christmas, New Year's, we were facing 105 hospitalized patients a day. We had an average statewide count of about 140, 139.6, as compared to now, which is 85.9 and dropping. And now we only have 55, 56 people in the hospital. Our statewide positivity rate was at 3.48%, dangerously close to tipping over again to 5%, where people expect shutdowns. And now we're dropped down actually to 1.91% as of today. It's down from yesterday. And you could see Hawaii County has done an extraordinary job shrinking our case counts, and our hospital numbers are really low. I can tell you that as of today, we had 0 patients in Hilo Hospital and 1 in Kona Hospital, Kona Community Hospital, and I believe 0 or 1 in North Hawaii. I have not seen the number yet today, but you can see that the numbers are very low overall, and that's good for individuals with COVID in the hospital. So we've done what's necessary to get through this crisis. They're the safe travels numbers that I referenced. Over 1.18 million people screened, and only 6,000 people are in quarantine presently because people finally caught on to the pre-test system. Now, this may change again and be made simpler once we ultimately are secure with vaccines, and we can allow people to travel, ourselves included, if we have been fully vaccinated and had 2 weeks to become immune. Then I've already proposed, and I think you're aware of it, I've proposed that we use that as our criteria for travel. It's actually a lot safer than a test. It's more reliable, but we'll talk about that some more. Quickly, here's our passenger count. You can see how we used to experience somewhere between 27 and sometimes 37,000 individuals each day, and we dropped down to none when we were locked down, and we now hover around 10,000 more often than not. This will go to 20,000 again once we open up with a test, and that will provide economic activity, and I believe very safely. Here's a bar chart of what it looked like as far as travel, and you can see the blue. The light blue is travel associated cases of COVID. Unfortunately, those light blue are us returning home from Las Vegas for the most part, and other places where we can catch COVID. And I'm not trying to diss Vegas. I love Vegas, but you get the idea. And then you've got the darker blue, which is travel associated non-residents. Mostly we've paired those out because people just don't travel if they know that they're going to get with a positive test, they have to quarantine. And so it's been effective, and it's now being emulated by several other countries, including the mainland United States, not a separate country, but our friends on the mainland, because they were and are very wary of the variants that are out of Great Britain. I'll comment, we may very well have some of those variants now circulating among us, although our positivity rate's low. And for now, I'm confident we can contain it. We have 4 pending tests, which we're supposed to hear about tomorrow, that may have been the British variant. And obviously, we are contact tracing every individual in that cohort because we're really concerned that thing is more infectious than the other regular variants. This is what unemployment looked like. We went from the lowest in the nation to 23% plus, and then back now down to under 9%. And that's going to come back down, I'd say, to about 4.5% in the coming months when we open up. So we're going to be getting back on track, although we have to make sure there's no COVID around. This shows that the economic activity has perked up a little bit. And I mention these things because eventually we're going to have to care for all of our needs. And I worry that fundamental structures can be compromised, like hospitals and gosh knows what. I mean, any number of things that we have to do, including our budget to care for people who are in great need, public safety, and so on, if we don't have economic activity. So trying to balance these things as carefully as possible. And now let's get to where I think everyone wants to talk. So we've received actually a total of, as of early this week, 227,600 doses. We've administered 181,704 as of yesterday. And you would think that they could have given me one more vaccine so I could say we did 10,000 shots yesterday, but I think they're messing with me at the Department of Health, and we ended up at 9,999. So we will talk more often than not now, which is good because those are 60,000 weeks. And enough, I know I really badly want to get into the 65 to 74 category, but let me make an important point right here. So we've done 181,000 doses. We have 109,000 kupuna that are 75 and older. So to vaccinate that cohort, that would be 109,000 individuals times 2, or 218,000 doses. So the progress is being made. 1A, there you see 1A, and I'm going to go to what it looks like. There are the numbers. By the way, that number 267,800, that's allocated by this Friday. We get the rest of those doses Thursday and Friday, today and tomorrow. And you can see how many we've received there, 227,600. I'm giving you more updated numbers even from the last 2 days. But 1A was healthcare workers and kupuna that live in nursing facilities. You can see the numbers there. We're pretty much done with these groups. The pharmacies have been excellent in long-term care vaccinations. That's CVS and Walgreens and just a whole bunch of pharmacies. They're also doing house calls even for individuals that are in like developmentally disabled housing or arches and so on. And then 1B, where we are right now, remember, here's the picture. Okay, we're moving forward in 1B, represents individuals over 75 and the frontline essential workers, of which it's a large category. It's mostly first responders. Teachers are in this category. People who work on the power grid, people who work in transportation. It's meant to be kupuna and those who care for kupuna, to be descriptive. And then we will soon, I think about March 1st, be able to move to, this is the frontline essential worker list. We've added to this list for those who are, for instance, like grocery workers who have a lot of vulnerability out there for a lot of shifts. And we're emphasizing, just so everyone knows, the older workers in this frontline essential worker category, people who are 65 or older who happen to still be working, they go first. So we are doing a lot of 65 to 74-year-old individuals, but we will quickly get to the bulk of individuals who are 65 to 74 in the top of 1C. Then also we'll include people with chronic illness, underlying health conditions, and the other essential workers that weren't as much front-facing but still had to go to work. And there's no way to put too fine a point on it. I mean, I want to get everyone vaccinated as soon as possible, and everybody wants to get it vaccinated now, that isn't philosophically opposed. So we're trying to push this as hard as we can. We're just going at the maximum rate that the federal government will provide us with vaccine. And there's very good news on the horizon, because the Johnson & Johnson shot, which will perhaps not be my first choice for our kupuna, will be able to help us with a lot of other parts of our cohort. The Johnson & Johnson vaccine is just one shot. It's simpler. It's only apparently in the US been 72% effective, 66% in Europe, but it does prevent between 95 and 100% of severe disease. So they have not seen fatalities with people who've taken that shot. And I imagine a lot of younger people are going to be happy to get one shot and be done with it, and who already have very little risk. Someone as young as James who can just take it. I mean, even if he catches COVID, it probably is not going to be too impactful, but having one shot may be very appealing, as opposed to somebody who is 83 years old and like my uncle or aunt, actually older than that, they're 87, and they would have a lot of risk if they didn't get vaccinated. And one of them has underlying health conditions. Here's some of the other considerations. The distribution is going on in parallel, so that we're having 1Bs while 1A is getting finished, and 1Cs will start, I believe, about March 1st, because some people will be mid-cycle on their shots, and we're not going to wait. We're going to get all these vaccines out the door best we possible. Right now, we're at about 80% of our vaccines in state being used, and then the only reason it's not 90 or 98% is because a lot of people are scheduled for next week. So you have to have a little bit ready to go in case the federal government drops the ball. And needless to say, we had some concerns about the way the feds were working as we were going through the transition between the administrations. That was that was kind of a harrowing experience. People were raiding the Capitol, and I didn't know what they were going to do. So, we wanted to make sure we were safe and not just race ahead and be reckless. So we also reserve some capacity in case there's a prioritized group that's having an outbreak. For instance, the non-Hawaiian Pacific Islander community has just 4% of the population, but 27 or 26% of all cases. There may be occasions where we want to quickly put out a fire, and we can do it with vaccines. Then the rest of the healthy population in phase 2 and 3, I think that happens about May 1st through the summer. But in the meanwhile, we can start opening up. These are the vaccination resources I would usually cite. Go to hawaiicovid19.com, and that's where you sign up. It's not perfect yet. There are phone numbers. I think HMSA is for both the kind of the big boys on Oahu and supporting Waimea. They do a lot of answers for those who answer a lot of calls for those who are older, try to sign them up. And frontline organizations that have essential workers can also do their survey and tell them how much they're going to need. And we're getting people aggressively vaccinated. So I'm going to stop there if it's okay, James. That's my social media hook. If people want the daily update, I do it, the 1 minute quick update, give the numbers. And, it's always my pleasure to share how to get in touch with me. So just don't hesitate, at all if there's questions. Some don't like me to share my cell phone, but what can you do? So anyway, that's where I am, and just get in touch with me whenever you have questions. I thought I might stay on and answer questions if it didn't hold everyone else back too much.
And thank you, Josh. Lieutenant Governor, really appreciate that. And we are going to have a couple questions for you, and then we can let you go if you are comfortable. I'm going to welcome in our board members, Nancy Carr-Smith and Lani Olsen-Chong, to kind of field some questions for you that have been submitted ahead of time. And this gives an opportunity for people who are watching the live feed to send any questions they might have, and I'll try and capture those here and intersperse those throughout. So I'll pass this over to Lani and Nancy for a couple questions to our Lieutenant Governor. Thank you.
Thank you, James. Thanks very much. Thank you, Dr. Green, for being here. We really appreciate it. You're a wealth of information here at this time. So we have a community member here that had some concerns. Grocery stores, emergency food providers, and restaurants, among others, are experiencing challenges with customers and clients who are claiming they cannot wear a mask due to a medical condition or a disability. Is there a formal medical exemption provided by doctors that can prove that that's the case?
Yes, if people have a pulmonary condition such as asthma or COPD, chronic obstructive pulmonary disease, they can get a note from their physician to not wear a mask. And the difficulty, of course, is if you confront someone and they've said that to you, they may very well not have a note, and it almost always ends up being an interpersonal conflict. What I'd recommend is, this is just me saying it, wear your mask and let it go and get them out of there as soon as possible so that they don't spread the disease. It always ends badly otherwise, and it ends up people spitting on each other and spittling and yelling, and then it's just doubled down on the problem. Sure. Normally I wouldn't walk away from a problem like that, but it's about to end soon when we're all vaccinated. So that would be my advice, but they can get an exemption.
So if the service provider refuses service to these people, do they have a legitimate legal case against the service?
If they can demonstrate that they have an exemption, yes. But if they don't have any way to prove it, then if the police show up, they will be asked to be removed, and that would be legitimate. So if someone is harassing your store and just constantly saying they have an exemption, tell them lovingly, show me your note from your doc, and no problem.
Very good. Thank you. Lani?
Yep.
Thank you, Nancy. Thank you, Dr. Green, for joining us this evening. What is the thinking behind visitors bypassing the 10-day quarantine if they have gotten the vaccine at a time when our own residents have yet to be vaccinated?
The thinking is that anyone who, and we'll apply this to all, anyone who's vaccinated is now immune after 2 weeks after receiving their second shot. So it's really a matter not of giving anyone any privilege. It's just that they're no longer a threat. They can't spread it. So that's really the overall approach. And it would also apply to us. We will come first, actually, in the proposal I gave to the governor, which is if we have completed our vaccine, we won't have to do the inter-island quarantine or have those rules. Nor would we have the travel restrictions. If we went on a vacation to the mainland and came back, we wouldn't have to do the quarantine or the pretest either.
Okay, thank you, Dr. Green. Nancy?
Yeah.
Thank you. Another service provider question. Wondering if on Oahu, is there any regulation going on, like with restaurants that aren't complying with social distancing or requiring masks to be worn? What's going on over there?
They get shut down if they repeatedly show that they're not requiring masks or that they're not complying. So the mayors of each county can shut them down with pretty much with impunity, frankly. So if that goes on, they can be shut. Now, having said that,
regulating that. Sorry, who's enforcing that?
The Department of Health. Department of Health is responsible for restaurants, stores, and others. It's mostly the Attorney General or law enforcement.
Okay, thank you. It's been brought to our attention that the pre-testing for inter-island travel is different for each island. Can you speak to that at all? Like if you're coming from Big Island over to Oahu for a couple of days medical, and then you come back to Big Island, the sequence is different. The process is different.
Yeah, that program is a mess. My advice was that first of all, we don't need any inter-island travel quarantines. It's not effective, with the single exception of Kauai, which has no cases virtually, but also has no travel there, and that's a very different beast. I don't think that program is particularly necessary, and the recommendation I've made is, number one, we should get rid of it, but number two, to the extent that we are getting vaccinated now, that anyone who gets vaccinated should be exempt from that, and that should quickly alleviate much of the strain on us for the inter-island travel rules. The rest of the rules should go out the window when we have that in place.
So once we're vaccinated and we have our card, we should be able to travel inter-island with no problem.
Yeah, even probably better than the card, we're also going to have an app from either a company called Clear or Health Pass, I believe. We're piloting it right now. So you'll just have a QR code that shows that you were vaccinated. That's it. And it'll also make the travel testing easier because they have like 30,000 approved labs, which has always been a kind of a hassle, to find the right test and get it done in time and so on. So trying to streamline that, if I was king for a day, I would probably clear out several of the rules that are just not particularly functional. But
well, too bad we can't make you king for a day.
Just one day, maybe. All anyone could tolerate, I'm sure.
Lani, thank you.
Thank you, Nancy. Dr. Green, one more question about the latest update on COVID. Besides social media, did I hear you say your social media was the best place to go?
It is. Yes.
Okay.
Because the reason for that is because I have a bigger mouth than anybody, so I'll actually give all the numbers at all times. And I get all the hospital numbers in real time, which is, the Department of Health has their hands full, but I'm getting a lot of numbers that are helpful with that. And so every day I push that out, and it's quick. I don't know that it's the smartest social media, but I'll tell you, you will get more information than you want in a minute and a half. And hopefully I can always update people on rules, things that are changing, the very good questions that have already been asked today. I often comment almost in real time. I'll usually give the governor like 48 hours notice before I start mouthing off about whatever proposal I've given them to think about, just so everyone else can weigh in on it, in case it makes sense, or if I make a particularly stupid proposal, people can shoot it down.
Thank you, Dr. Green.
Sure.
Well, thank you, Nancy and Lani. I think that's what we've had for the pre-submitted questions. I do have a couple in here, Lieutenant Governor, that have come from Facebook chat. So I'll field those to you now.
Yep.
First one up. This is, you can kind of think about a scenario for this where someone from, a traveler who's been here for a while, living, maybe they've have a long-term stay here. Are these vaccines only for locals, or can people that have been living here for a long time, 6 months out of the year, get online for this as well?
Yeah, that's the rule. It's 6 months. You're supposed to have actually been a 6-month resident before you can get be eligible for a vaccine. There is going to be some leakage because you sometimes don't know. But in fairness, I know that some of our people have gotten vaccinated when they've been traveling abroad or on the mainland. But we're really trying to just stick with our own people. I would expect that once we come into summer, we will have a surplus of vaccine available, where we'll just be going to our local pharmacies. Then we may lift that rule because it'll really be, by then we'll be down to the people that are just opting in and haven't needed it or wanted it. They'll be getting it later. At that point, I don't think we'll care.
Thank you. The next one's about rapid tests and questions about where are they being administered in Hawaii? At all of the airports?
Forgive me, you glitched out. Was it the test?
Yeah, the rapid tests, are they being administered across the state, and where specifically? And are they at the airports as well?
Almost exclusively just in Hawaii Island. There's some rapid testing that they do, I believe, in a limited fashion on Kauai, but not much on Oahu at all. They've really pretty much stuck just with the pre-test. And it's done pretty well. I will say, though, if some enterprising PhD student wants to write something special, they should write about Big Island and how Big Island really, tracked and traced the disease and was able to keep it down. Really great victory. And let me give some kudos to Dr. Miskovich, Mark Benioff, Mayor Kim, Mayor Roth, and really all the people there, our people on Big Island, who have tolerated a fair amount of poking and prodding, but it's worked. I mean, it's keeping the numbers in a good space.
Thank you. The next one is about concerns about vaccine and the potential for being a spreader yourself once vaccinated. Is there evidence that demonstrates how effective this immunity is, or can you be a potential spreader yourself?
The jury is still out to a degree, although it appears that the early data suggests that it is driving down the viral load very significantly. And so this has been the case with all other vaccines, which it does do, like the flu shots and pneumovax and what have you. They've all dropped down the amount of virus that you can carry. And this would be shocking if this was an outlier and being immune still carried the same amount of virus and could spread it. But I am in touch with the CDC and the FDA, trying to make sure that we get that data. It does look good, though. Some of the vaccines have already demonstrated this concept, which is sterilization immunity. That's the word, sterilization immunity, that you get the vaccine, you're immune, and you've sterilized your upper airways, the nasal pharynx, the throat, and so on. It looks good. It will the viral load enough that it will not be a major issue, but we're going to still ask people to wear masks until we get herd immunity.
Thank you. And this last one, so the last one I have here, and then I'm going to open up to our guests on the call here, actually, if they have any requests of the Lieutenant Governor. But this last question that came in from the community is specifically about the Johnson & Johnson one. It's showing only about a 70% efficacy. So where is there, there's going to be some concern about that. If you could speak more at length about that one, and how do we manage that those individuals that aren't covered or not being, it's not being effective for those individuals?
Yeah, that's actually a very good question. So there's good news, bad news here, right? The good news is it's 70% and you only need one shot, as opposed to, for instance, the Pfizer and Moderna, where you only get about 50% immunity from the first shot, and some people could skip out on the second one and not be fully immune. The bad news is that 30% of people will still be susceptible to catching COVID. I will say this, that the secondary data is very good, that people who take the Johnson & Johnson shot have only had mild to moderate disease at worst. They have not had severe disease. So I would envision different groups of people wanting that. We are already in advanced discussions about when people just ask for one shot and they tell us that they will absolutely refuse a second shot, that we give it to them, or we offer it to them right away. Also, I don't want to be cruel here, and I would never discriminate, but the homeless community, which is often, especially amongst those who have substance abuse, is often very reluctant to come back for anything a second time, and is very mobile, and they also may prefer that. So, but everyone will be given the offer of the best shots, which appear to be at this point Pfizer and Moderna. The other benefit of the Johnson & Johnson shot is the ability to go into rural settings, or settings that it's that are like, if we have a mobile vaccination pod, point of distribution pod, because you don't have to keep it at super low temperature. And then finally, there may just be some young people that, like I mentioned earlier, they might just want one shot, that's it. And right now we're anticipating that about 20% of the population will not take anything. It may very well be that among that 20% of the population, half of them will choose to have one shot that's been somewhat benign. And again, it's kind of a this is better than nothing situation. I will tell you, Jamie told me she may take the Johnson & Johnson shot. She's younger. My wife is 43. She is healthy, and she felt that may provide enough immunity because it's low risk for serious disease. So it'll be interesting to see, but we'll offer all options to people, and they'll vote with their own decision.
Thank you, Dr. Green. And I'm going to open this up. If any of our other guests on the call want to jump in and ask the Lieutenant Governor a particular question, you're more than welcome to. All right, Lani, did you have another question for Lieutenant Governor?
This is about contact tracing, Dr. Green. How can we improve our contact tracing program?
Yeah, that program was a disaster in the early days when we were like March, April, May, that thing failed us. And so we beefed that up from like 16 people up to over 400 at one point. It's a great challenge. A lot of people don't want to answer the phone when they've been contacted, but the best thing is persistence and continuing to fund that program with the resources we're getting from the CARES Act, and just not let up. Also, it's very likely that we may end up using National Guard again if we don't have additional personnel that can do it, because we're going to get 100% reimbursement on National Guard under the new administration, which, it's just good. I don't know what to say. It's good service. So that's how, these are the many ways we can do it. I also am hopeful, knock wood, that we will just need a lot less, because I think that our case counts are going to drop down into the 20s to 30s again, down from our average of, what did I say, like 85 a day. At 85 a day, it presses the ability that they have to call 6 to 10 people per case and trace them. At 20 to 30, it's quite easy for the Department of Health to keep control over things. So we just got to keep at it and support whichever organization is willing to step up, whether it's our hospitals or our departments of public health in the counties or whatever.
Thank you very much, Dr. Green. James, back to you.
All right, thank you. I have 2 questions that came in here, so we'll go with the first one here, Dr. Green. The first one's about your thoughts on recommending and requiring certain employers or schools to vaccinate their employees and or students.
I feel strongly that we should recommend, and I'll do it personally, that everyone get vaccinated. As to requiring or making it the law, I'll just tell you where I fall on personally. I don't think that we should mandate it. In this particular case, that may come as a surprise to people because they know me to be a very pro-vaccine and physician person, but this vaccine was done through the emergency use authorization, so it's not legal actually to mandate it until it's fully federally approved, which probably won't happen for many months. And second, I think it will backfire if we do that. This is just me being a pragmatist here. I think if we force people to get the vaccine that came on pretty quickly, I'm afraid that it could have negative consequences. I think we can get there and get to herd immunity by sheer will. I've seen already some internal polling that shows that just 2 weeks ago, when we were sitting around 50% of approval to get vaccines, people would do it. 25% said they probably might if they were convinced that it wasn't harmful, and then 25% wouldn't. We appear to be seeing now numbers between 80 to 90% of people that are willing to get the vaccine in the coming months, now that they've heard from their friends that it's been a pretty benign process. So anything over 80%, we're going to be completely immune in society. I think we'll be fine.
Thank you. And our last question for you, Dr. Green, is really about community and the community effort and how community organizations like ourselves and others in our community and around the state can really support the vaccination effort. What can we do?
That is an excellent thing to ask, and thank you for that. You should hold as many information sessions with the local doctors, local nurses, local experts on this matter to reassure people. I'm daily doing a couple myself to long-term care facilities or nonprofits just to share my experience and also get the real basic information about how to sign up for it. It's obviously a little bit of a lift right now because we're doing kupuna, and some people over 75 are not as comfortable on computers and signing up that way. So we can also reach out and help them find a way to literally sign them up through our own app, watch or phone or computer or iPad or whatever we got, right? But help people sign up that can't, give them good information on how to sign up, and just, spread good science-based information, because the internet's a little bit hairy these days, and community organizations can combat that. In Hawaii, word of mouth and the coconut wireless is quite powerful. And so I hope that, you guys have a very long-standing reputation as being a solid, thoughtful group. Use that to spread the word and to coordinate with our local hospitals.
Thank you, Dr. Green. And any last words you'd like to share with the community here before we let you go this evening?
Well, the Super Bowl's coming up, and in spite of my team being out of it, I would tell you, please wear a mask if you're being with friends, and under no circumstance should you double dip your chips, because that will spread COVID 100% certain.
Thank you, Lieutenant Governor. Once again, we really appreciate all your time you spend with us on these calls and reaching out to the community and connecting with everyone in this format and setting. Wish you all the best, and thank you so much. Mahalo. Thanks
for having me. I appreciate it. Take care.
Aloha. Well, that was wonderful. Thank you, Dr. Green. So this next minute here, I just want to offer some community announcements as we progress through the evening here. The first one I'd like to mention is about the Hawaii food basket, actually. And we had a large gathering and a large drop here in Waimea just the other day. Grateful for the support of Hawaii Food Basket, offering to our community members here and those in need. They will also be up in Kohala. They were there up today at Kamehameha Park, but next week they will be in Waikoloa Village on Friday at the skate park. And then they'll be in Honoka on February 26th at the Honoka Sports Complex. So you can find that information on the WCA Facebook page. We have that information posted up there for you, so you can view that. And the next one, I'm just going to put up a little image here about some other events that are happening in the community here. Excuse me 1 second. All right, so the first one, get these photos up here for you to see. And we talked about this last time a little bit, but just want to bring awareness about the Family Food Truck Friday once again at Anna Ranch. And this is on Friday, February 12th from 3 to 7. Local food trucks, support local businesses. I encourage you to attend this alcohol-free event and enjoy a Friday there at Anna Ranch. The other event here is actually in Waimea as well. So this is at Isaac's Art Center here in Waimea. They've just opened their 35th Invitational Masters Wood Guild show. So I recommend you checking out the art there and the woodwork there from our local artists. This is free and open to the public. Hours are there up on your screen from January 18th to February 26th. So it's till the end of the month here. So that's Isaac's Art Center. That's next to the community center, right next to the park there in town and across from Long's and near HPA there in town. Just a reminder that all of these events are, they practice social distancing. Please be sure to wear your mask, bring your mask, and be respectful of others in those spaces as well, both at the food truck event and at any other events that are happening in the community. If you are part of an organization and you would like us to share something about your events that you're putting on, we're more than happy to put those on our Facebook page or share them in this setting on this fashion. So please be sure to reach out to us so we can inform the rest of the community about some of these events. And in that sort of sense, we want to thank you, our viewers, and our fellow community members for continuing to do your part in preventing the spread of COVID-19 by, practicing social distancing, wearing your masks, and avoiding large gatherings, and helping to maintain this low rate of infection that we've seen in our communities that Dr. Green has just shared with us. Also, please be aware of any COVID scams that you see online or in emails, particularly about vaccine as they relate to the vaccine. Please continue to do your part for the health and safety of our community and our loved ones. This is our kuleana, and we hope that you will consider being vaccinated when the time is right for you and the opportunity is presented. So mahalo for those words there. At this point, I would like to welcome Captain Sherry Bird and Community Police Officer Aaron Kaeo to present with us a few community policing updates.
All right. Hi, James. Can you hear me okay?
Yes, thank you, Captain Bird.
All right, perfect. I'm going to turn it over to Officer Kaeo. He has our community policing update. So, Aaron.
Good evening, everybody. Okay, so this is for our, we call it a crime trend and traffic trend reports for our South Kohala district, which does encompass, like everyone knows, Waimea, Waikoloa Village, the Waikoloa Resorts, and Kauai. In the month of January, we had 6 assaults. Highlight of that is, everyone saw that on the news media. There was that assault where a man was assaulted at the resorts by people. The investigation is still ongoing. We had 2 burglaries. No trends, no signs of forced entry in that. We had 4 criminal property damage reports. Highlights from there is there was a resort guest who had reported that his motor vehicle was damaged while it was parked overnight, and a phone was damaged during one of the above assaults. We have no robberies in our district. There were 11 total thefts in our district for the month of January. 6 were of the felony level. Bulk of the thefts were in the Waikoloa resort areas. It seems to be as if that as businesses are all reopening and there's more foot traffic, thefts are starting to come up a little bit. We just want to make sure everybody realizes that you are accountable for your things. Make sure you have your things in sight, and so we can bring those numbers down. There is 1 auto theft in our district. There's a suspect that has been identified and APB made. And there was 1 UEMV, or unauthorized entry of a motor vehicle, that's coming on as a car break-in. Suspects have been identified and are in the hands of the prosecutor's office now. What I would like to say is that please have your eyes and ears open. For us, we can't be everywhere at once, and we need your eyes and ears to solve and prevent and deter further incidents. I do also want to remind everyone about, even though we're out of the holiday season, there is still a thing about mail theft. Please always check your mail, get to know your neighbors. They watch you, you watch them. That's the best type of security there. And also, I do want to point out there is a new traffic pattern. Thank you to Waimea Community Association for posting that on their Facebook. This is a traffic pattern at the Waimea Elementary or Waimea Middle School. The Waimea Community Association Facebook page has a picture of it, but we just want to let everybody know that the entrance to the school is from Lindsay Road at the back gate entrance near Kahilo Theater. You'd go through there and exit at the Mamalahoa Highway, the old entry exit. This is between 7 a.m. and 3:15 p.m. The picture does a better justice of it, but I do want to point out that there is a traffic pattern there that has changed for the school. I just wanted to give a shout out to Waimea Community Association for putting that out. Moving on to our traffic trends for the month of January. Our district officers issued 817 total citations. The bulk of them being speeding and moving. Numbers are 196 speed citations, 139 moving, 43 seatbelt violations, 282 regulatory, so that's expired safety or no registration or correct papers in the vehicle, 83 unsafe citations, so that's more like broken windows, there's no mirrors on the vehicle, balding tires, 44 mobile devices, 6 operating a vehicle under the influence of intoxication, formerly known as 6 DUIs. We have no fatals this past month. There was 5 major traffic collisions, which is we're down 66% from last year. Some highlights from there was a pedestrian struck on Waikoloa Beach Drive, was transported for minor injuries. A vehicle swerved to miss I believe it was a goat on Waikoloa Road. Ended up in the ditch. No one injured in there. Someone lost control on Kohala Mountain Road. No injury in that. And a operator crossed the center line at the Waiaka Bridge due to the sun glare coming through. That one, people were transported, but with minor injuries. That would be our crime and traffic trends for this month. Thank you.
James, I just wanted to say one more thing, end our segment with our department is hiring. So our recruitment starts this Sunday, February 7th, and it closes February 16th. So if anybody's interested in looking to join our department, recommend they go to www.hawaiicounty.gov and they can look for the minimum qualifications and how to apply there.
Wonderful. Well, thank you so much, Captain Bird, and thank you, Officer Kaeo. We really appreciate your time this evening and joining us and being a part of this call and sharing out to the community on your report. I appreciate all your time and all that you do for us. Thank you. At this point, I would like to welcome Hamakua Health, our CEO for Hamakua Health, Irene Carpenter, and their Chief of Operations as well, Milton Cortez, as we highlight Hamakua-Kohala Health as the WCA nonprofit spotlight for the month of February. So I'd like to pass over to Irene, if you're ready.
Sure. Thank you all. You know, it's been a long day, I think, for all of us. And I know I've been up since 4 this morning, so I'm a little running out of steam, but I really wanted to be here tonight because we have a lot of really good stuff to share with you. And there's not that much good stuff going around anymore. So, you know, I thought this would be a nice venue to share things. The couple things. One is we are vaccinating our patients. We have the need for 26,000 doses. And we've received 1,800. So, you know, we're doing the best we can. We're getting them out there as fast as we can, and we'll continue to do that. We also are hiring new staff. We're looking to be up to about 100 employees in the next couple of weeks. We're creating a lot of sustainable jobs in healthcare. We hired 7 people this week, and we have job openings. You can check our website or call the Honeka'a office to speak to Missy Ann Rose. She's our HR director. So this is February. In January, this past month, we doubled in size. So we went from 5,500 patients now to 13,000 patients. Okay, so we're in a growth explosion here. And one of the things that we're looking at specific to Waimea is space. So we have rented a space in the Mauna Kea Center, which is the green building right next to the gas station that's closed at the Four Corners. I think everybody knows kind of where that is. So we're redoing the inside of it, moving the doctor's offices and putting in handicapped bathrooms, et cetera. And we expect to be in there in May to be providing services. This would be both primary care and substance abuse counseling, mental health, with psychologists.
Sorry to interrupt.
Go ahead.
James, would you do the presentation?
Yeah,
Absolutely. Here we go.
forgot we had slides. Okay. All right, we can go past. That's our name. Okay, so I wanted people to know how long we've been around. The Plantation Infirmary was 1966. We became a rural health clinic in 1994, and we are now a federally qualified health center as of 1996. So quite a while we've been that. The Kohala Family Clinic up in Kohala, which is right next to the hospital up there, we took over a private practice there and are continuing to run that, and we took that over in 2006. In Lapahoihoi School, which is a charter school, the only school in Lapahoihoi, was having a lot of serious behavioral health problems. We opened up a behavioral health clinic there with a psychologist in it, and we are now talking to that school about expanding to put primary care in there and also access for kids to go to the dentist. And in 2019, we opened the clinic in Waimea. We know there are a lot of doctors in Waimea, but not a lot of them that are really interested in taking Medicaid and Medicare patients. So our job as a federally qualified health center is to get people access to primary care. That's, if there's one way I could explain it, that's it. So we deal with people who are uninsured or underinsured, but we also take people with insurance. And because we happen to service, you can see on the map that area, we have a lot of people who had been working in the hotels and had insurance primarily through HMSA. And, they had pretty good insurance. Now they have no jobs and no insurance. And, I'm not blaming that on the hotels. We all know what happened there. But I think one of the things that Josh mentioned, which is something we have been looking at, is that there is a 15% increase in Medicaid patients. We're talking about 50,000 new Medicaid patients already, and it's going to continue to go up. And we serve Medicaid patients. We also wanted to really get out to everyone that's listening, or that you have connection with, is we don't care if you don't have health insurance. We love it if you come in and you tell us you don't have health insurance. It's not a problem for us at all. So if you know somebody who's saying, yeah, but she didn't really mean that, I really don't have any money and I have we don't care. Just call us and we'll work it out. So we have federal grant money, and we have money to take care of people who have no insurance, who have crummy insurance, who are about to lose their insurance. We don't care. We figure it out and we'll take care of you. And we're not going to figure it out first and take care of you. We're going to take care of you first and then figure it out. And that's something that, that's what we're about. And we're going to continue to do that. So, that's part of why we're hiring so many new staff, because, we've increased our patient base. In the last month, we have also picked up private practices. We have a lot of doctors in the community who are just overwhelmed with that process of billing, and billing gets sent back, and office management, and whether they can hire somebody that's going to answer their phones, and all the business end of operations. So what we're saying to private practice doctors and doctors working in other places, that if you want to just be a doctor, see your patients, diagnose them, put the diagnosis in the computer, and have your check sent to your bank, then you need to come and talk to us, because we do all of the other stuff. They don't have to worry about anything. So at this point, what's happening is we've picked up the practice of Dr. Gertzen, we've picked up the practice of Dr. Dawson, and we picked up the practice of Dr. Perlis. This is just in the last month. So that's part of our expansion, but we've also seen a very rapid increase in patients who've lost their insurance along with their jobs. And because part of our job is to increase access to health in the community, we want to make sure that we have doctors and APRNs and other clinical practitioners that can give them care in the community. So we're doing everything we can to make it easy for the doctors to stay here and get the support they need and be able to just see their patients. And that's working out really well for us. At this point, I work with the Hawaii Primary Care Association. It's a statewide organization, and also with all the other CEOs that run community health centers across the state, and a lot of them that I know nationally. And although there is, of course, a huge doctor shortage throughout the country, we don't have a doctor shortage. I have a waiting list of doctors that want to work for us. What I don't have is any space to put them. So at this point, we've rented the space in Waimea. We're increasing the size of the clinic, and we're going to have that built out by May, and it still won't be big enough. So we're going to continue to be looking for more space, and we're asking the community to help us with, any ideas you have so that we can continue to service more people. We have the ability to bill for the services. I think a lot of nonprofits, it's like, well, I don't have any money. We can bill for the services. That's not the problem. We have the doctors. That's not the problem. Right now, what we don't have is actual clinical space. So, it's a nice problem to have, but it's also, there's a lot of things going on for us to expand. On top of what we're doing in Waimea, we're also increasing our space at the school in Lapahoehoe, where we are going to put in dental services and primary care. We already have behavioral health there. We're increasing access to care in Kohala. Oh yeah, in Kohala. What you can see, there's a picture of, we bought these two, small buildings, and they're called clinics in a can. And what they have in them is a little medical clinics, and we can move them around, as you can see. So right now they're up in Kohala at our current place that we're renting. And I expect on Monday, this coming Monday, to have completed the purchase of the Kohala Hotel in Kohala. For those of you who, might know about it, it's about a 5-acre piece of land, and it's, going from the hospital into town. So it's in a great location right on the main road. We are going to change the hotel over to be a health clinic, and we're going to be starting to do that. If we close on Monday, we're going to start on Tuesday. So we'll be moving those 2 clinics over there, and then using all of the other facilities in the hotel to deliver clinical services. And we're also looking for, help from the community, because we have to do a lot of things there, like fix the handicapped accessibility. It's a nice building. You see the yellow building there, the nice little porch. We're not going to change that. We love the way it's kind of like the old plantation setup. It's really quite nice. But we do have 5 acres, so we're going to develop some more facilities. And one of the things we're looking at there in Kohala is to use the back, 4 acres in the back, to set up training for doctors and APRNs and other clinical people to do both research and to practice in rural health areas. And so they would be practicing in our clinic and also training at the same time. So we're talking to JABSOM and some other possible partners on that. So we have a lot of big plans, but it isn't all talk. We're actually doing it. And that makes me feel, really good. We have increased our behavioral health staff. So now we have several psychologists, certified substance abuse counselor, pain management clinic, access to a psychiatrist. And, we're just building in every single way that we possibly can. And we really want the community to know we're doing that, and that, we could use your help. I mean, in all kinds of ways. We need money. We need people who understand about construction, that kind of thing. So, if you have any ideas on how we're expanding in the Waimea area, you can certainly get in touch with me. I think my stuff is coming up. My connections are coming up in a slide. We have also placed our amazing tooth bus in Waimea at the St. James Church, and we have a dentist and a dental assistant there who provides dental care for children. Again, we don't care if you can pay. We don't care what kind of insurance you have. Just call. We'll set up an appointment and have your child seen. One of the things that we're working on is that we have, unfortunately, a large population of people who still think that there is no need for children to brush or care for their teeth because the whole first set's going to fall out anyway. And we really want to reverse that, because that is not a good attitude towards taking care of your health. You want to build that up from childhood. So, those are the kinds of things we're working on. We also have smoking cessation and vaping cessation. As you know, you may know, we have the highest level of vaping going on with kids, high school kids in the entire country. This is a big problem for us. And so we're looking at how we can take care of that. We have a pretty successful program with that. And we continue to offer people, smoking cessation products. If you can't afford to pay for them, your insurance won't pay for them, we have them for free for you. We just want you to stop smoking. We've also recently hired Robin Ramsey, who some of you may know from the community. She's been practicing there for a while, and she is providing women's services for us. So we're continuing to expand our women's services, and going from pre-pregnancy right through birth. We are part also of an accountable care organization called AHARO, AHARO, and what we've done is we've pulled together 5 community health centers across to both Oahu and here and some of the other islands. And we all meet regularly and we all talk about what's working. What is the best thing that's been working for us? How do you get people to take those, colon cancer screening tests that nobody wants to take? And, what that's really necessary. You need to do that. So we're sharing best practices, not only clinical best practices, but business best practices. And I think that has really helped us tremendously. And we now have a new a setup so that all of us are linking together with our computer systems, and we can pull data on what's working, what's not working, where patients are coming from, whether they're going in and out of the hospital, and a lot of other things. So, collaborating and pulling together our resources. And we can do that because we're not competing with anybody. We're just all trying to help each other out. And that's been, really helpful. We're also part of the Hawaii Primary Care Association, and they advocate for access to health care for underinsured patients, and they provide us with technical expertise. We do a lot of different programs and things like that with them, and they're really helpful. So, we've got some help in some different places, and we use all of it. And I just, wanted to make sure that you understand that we're funded through a lot of different sources, grants. We bill insurance companies. We're funded through the federal HRSA contract. And that contract requires us to do things that people who have regular private practices do not have to do and do not do. One of them is we can pick you up and bring you to your appointment if that's necessary. We will translate what's going on in your healthcare in any language that you speak. There's a myriad of different things like that we do that other regular primary care providers, they don't have to do and can't afford to do under the model that they have. I wanted to also really emphasize that when a person comes to us with the best, say, HMSA insurance that they could possibly have, we get paid less than when somebody comes to us who has no insurance at all. So we are not just saying we like you because you have no insurance. We want to take care of you. It is our mission, and it is not a problem. We don't want any shame or any embarrassment by anybody. They're doing us a favor by coming in if they have no health insurance. So please, any way you can get that word out. We want to make sure that people are not saying, I lost my job, I don't have health insurance, I can't afford it, I'm ashamed, I don't want to ask for help. That's the last thing we want. We want them to come in before they're so sick that they have to be hospitalized or or losing their eyesight, things like that. So, we're doing, I think, a really good job. We're expanding all over the place. And I think that with the help of the communities in Waimea, Lapahoihoi, and Kohala, we're going to continue to do that. The other thing that's happening with us right now is we own, I'm in the Honaka'a Clinic right now, and we own an acre of land right across the street from where we are now. And we're about to demo that building. It was an old infirmary from the plantation days. It's on about an acre of land and right next to the park. And we're building a new health facility there. So it'll be a large new health facility. We've already raised.
Thank you. Well, Irene, thank you so much for joining us this evening. We really appreciate all the time you could give us. And that was great to have the slides there with your contact. And that was the best email I think people could reach you at if they have inquiries about job opportunities with you. Is that correct?
Yes, they can do that.
Okay, wonderful. Well, thank you so much, Irene, and thank you, Milton, for joining us this evening. It was great to have you on the call here and spotlight you as our nonprofit for February. So thank you so much, and we wish you all the best with all the work you're doing months ahead, with expansions and everything. And thank you so much for supporting our communities.
Thank you.
All right, and so I'd like to move on to our last few guests for the evening here. We have a couple different guests on the call. We're going to start off with some of our county representatives here. And I'd like to welcome on the call Stephen Bader from Hawaii County, who is the executive assistant to Mayor Mitch Roth. Stephen is also the county's lead on COVID-19 response. And along with him, we have Talmadge Magno, who you all know is the director of the Hawaii County Civil Defense. And I'd like to welcome them both on the call here at the same time, and they're welcome to share their time or however, what would you like, and give us the community some updates and guidance on the county's perspective. We've heard from the state with the Lieutenant Governor, and we're grateful to have both of you gentlemen on the call to share your expertise and the issues we're having and all the concerns we're having at the county level. So thank you so much. I'll just make sure you're unmuted there. All right, let's see, gonna try again. All right, we got Talmadge on. Steve, I think I still have you on mute there. See if you wanna, there might be a prompt up for you to unmute yourself.
How about
There
that?
we go. That's great.
Okay.
Thank you so much for joining us.
Sure. Thank you for inviting both of us here. And on behalf of the mayor, who is getting better every day, we want to mahalo to you to make this opportunity. You know, Josh went through a lot of stuff that I had because he covered statewide, but he also did a lot of stuff locally because he's a local guy. You know, he's from the Big Island. So, you know, I guess what I'll do is talk more about just sort of where the administration is looking at, and Talmadge and I see each other every day at work, you know, so he has history and he can give some details, and but I'll tell you where our concerns are and what we're doing looking forward. You know, we've with the new administration coming into place with Mayor Roth, we wanted to keep the current system of testing in place, and that's been real successful, as Josh has said. You know, I would say there's 4 components to it, but we have that airport testing program, which is unique to the state and actually unique to the country. We understand doing that secondary test. The district testing, which is biweekly in Hilo and Kona and weekly in Kaeo. The mobile outreach, we have 2, sometimes 3 times a week. We're out of Waimea, Kapa'au, Pahoa, Kalapana, Maku, Na'alehu, Volcano, Waikoloa, and others. And then we do the targeted spot testing too. So there's 4 components: airport testing, district testing, mobile outreach, and the targeted testing. We are focusing right now on the targeted spot testing on a cluster in one of the Kona coffee farms. And that cluster is, I think, at 18 right now, and it's been at 18 for a couple of days now, which is good news. That means they've been able to isolate folks, and there's testing going on about every 3 days. I think we've been at it for over 10 days now, maybe close to 12 days. So, and there was a larger group of workers there than you know, certainly I had anticipated. They had over 100 workers working that farm. So anyway, that's got our attention, and the target spot testing is worked out. On the airport testing, I'll just say that we got to 100% on the Trans-Pacific testing, our ability to do 100% during the holidays. So December 27th is when we got to that number. And the success of the program, you know, is that over the last 4 months, we've been able to identify over 100 COVID positive travelers. And if you think about it, if those 100 travelers were undetected and they had contact with 5 to 10 people when they're on the island, and those folks had contact, you can see you can get community spread really quickly. It could have gotten out of hand. So, you know, although that it has taken a lot of time and resources, and at different times, you know, people have characterized it as being sort of overboard, it's been effective for us. as Josh had mentioned. So we wanted to keep that in place. It was a little challenge on the funding because the CARES Act money, federal money, was running out in December, and then we were able to work with private philanthropists to help us continue that testing, which is scheduled to go through the end of February, but we're looking forward to that. And I think we're going to keep our programs intact for a while. We haven't licked this thing yet, so we're going to keep things in place. The challenges we've been having, of course, is doing outreach to rural areas and continue to outreach those ethnic cultural communities that have been impacted. And the mobile testing, the outreach, and the spot testing, I think, has been effective. But that's an ongoing situation for us. Some of the good news, even since I've been here, which has been just a couple of months since the new administration came in, is that the testing efficiency has improved. And Talmadge can talk about that because he's been at this for a while. But it's good to see that our testing providers have been continuing to improve how they do things, and that's improved. Funding, we anticipate through the last CARES Act that was signed off in December that there'll be some resources available to us to continue our programs. And again, I'll let Talmadge talk about some of the wraparound services and stuff that we have in place. And we're very optimistic in the Biden relief package that is working its way around DC right now at the Capitol. I mean, there's, in spite of all the negotiations that need to happen, but we're pretty optimistic that that's going to result in additional monies for at the local level for vaccinations and testing. On the vaccination side, as Josh went through all those numbers, you can see that we're statewide, we're short about 40,000 dosages. And as we kind of work on the island, work through the 1A phase and finish then off those second doses, and we've already started 1B. The demand for vaccination is very high, and all of us who are involved in this effort have been getting inundated with requests on how we can make sure we can get those doses, get those shots in the arms. I was at a meeting today with Hilo Medical Center, and they said that if they had the right size venue, they probably could get up to 4,000 shots a week. And we're kind of working with them right now, looking at the possibility of using the county's venues and in setting up large scale vaccinations. And the same effort is happening in the Kona side too. So I guess right around the corner, hopefully, within the next few weeks to over the next month or so, you're going to be seeing a lot as we help pull those programs together, working with Department of Health and all our partners. So we want to scale up. The demand is there. We have some, we've all, and this is nationwide, we've had these issues with supply chain and delivery issues. And I know people are pretty frustrated because they see things on social media, on the news, and they want to be able to get the shots, and there's this issue of whether there are doses sitting, in storage somewhere, and they're, if they're there, we're going to try to get them out. And the more we're prepared to do those larger vaccinations, the more dosages I think we're going to get. But so anyway, that's coming. That's around the corner, and we'll be working closely with Talmadge and Civil Defense. Our whole county is dedicated, committed to it, and certainly the mayor is. I want to mention a couple other things, sort of big picture things. and that is the governor's proclamation will expire, I think it's on the 14th of this month. He's already indicated that aside from a few minor tweaks, he's pretty much going to keep the same sort of the same basic structure of that proclamation is going to remain, and with a few minor changes. We are, as a county, looking at possibly amending some of the county rules, where we are to see if we can evaluate again things like the numbers for indoor and outdoor gatherings. I know the mayor is interested in looking at that, making sure we're consistent about how we look at sports activities, and look at our terminology, our descriptions and exhibits, as far as how we're describing things that are that we might have concerns with, or as it relates to commercial activities or gatherings and stuff. So anyway, we're kind of taking a look at that, and the county has a process where we have a policy team that looks at all of these things with our corporation council, and looking at what the governor's proclamation says, and we see how we can make that work. I mean, definitely we're concerned about, as the lieutenant governor was, about making sure we start looking forward towards opening things up again, but try to do it in as safe a manner as possible. So people ask all the time, are we just going to stay in this sort of pseudo lockdown period, or are we going to move forward? And the answer is that the numbers are looking better, and we're going to do it, but we're just not willing to do it until we have a good handle on things. And right now things are looking good. So that's something that we want to make sure that people know, that we're thinking about that, and there's some changes, potentially some changes that might be coming. The last thing, and I'll turn it over to Talmadge after this, is that we're paying attention to the legislative session. There are proposed bills in the legislature right now that deals with rules enforcement, travel testing, landlord-tenant issues, and some other economic development incentives and recovery incentives. And as a county, we're keeping an eye on that. At the same time, we're trying to make sure that we have a good picture of what those CARES 2, which is the last relief package, and CARES 3, which would be the Biden relief package, how that plays in. So we've been busy. And I'm glad that Dr. Green said that he is the go-to site for information, because it is pretty frustrating when you can think you're getting the latest, greatest information, and then, within minutes you can go back on a site and see the numbers been updated. And this happens to us all the time. And Civil Defense and Talmadge, we sit in meetings, multiple meetings a week, looking at these dashboards, and sometimes it's just timing, sometimes it's the way people manage their data, but it can be, if you're from the outside looking in, it could be really frustrating. So now we know Dr. Green said his site is the site, but if you want to check the ʻIwalani dashboard is pretty accurate, and if you just go Google ʻIwalani and COVID, it'll pop up. And of course, the County of Hawaii and the Civil Defense, we're using a lot of the same information. And Dr. Green Josh gets that information too. But I think he's, as he says, that he can get some direct numbers sometimes a lot quicker because of the role he plays in the state and as lieutenant governor. So I'll end my piece there. I know we're running a little late, and see if Talmadge want to throw in a couple things. Talmadge is on vacation right now. He's which is well deserved too, and he's over there calling in. So appreciate Talmadge spending his time calling in.
Yeah, thanks, Steve. Thanks, James, for having us on here. It's a pleasure to be here. Biggest thing I wanted to share is that the counties, all our actions we're definitely collaborated with all our partners. Department of Health, we don't have a Department of Health county operation, so we depend on the state Department of Health for all the information. So we collaborate with them, like Steve says, every day since last January. The Mayor Kim and Civil Defense, we'd be sitting in the Emergency Operations Center every morning, talking with Department of Health, looking at the numbers, seeing where infection rates were happening, and seeing what we needed to do. And that's what started our testing profile, going district testing, a strategy where there'd be testing for the community at the same time, in the same place every week, so the community would know where to go. And then branching out to target testing when we see specific areas start to get hot. And then, like Steve mentioned, the spot testing specifically for clusters that kind of are private, where we just do testing for that operation. So, and this included all the branches of the county departments. National Guard was big at it. They've been assigned throughout this whole mission, and they've been extended all the way till September, I believe. So, they're a big resource. You've seen them everywhere, from the airports, to our testing sites, food distribution. They are incredible resource that not only us, I think every state in the nation is utilizing. And with the president saying they're available 100% till September, we got to thank those guys, because a lot of them have their own careers. They're kind of putting that on standby. Their families are understand they're enlisted, but there is a setback as well for them. It's just like they're being deployed. So hats off to the National Guard. Can't thank them enough. The county has supported a lot of operations. Besides the policy group, we also have groups that do prevention and education. Whenever there's issues in the community, before the police take action or given the notice of what's going on, we try to educate, whether it's businesses or beach park areas or whatever user it is, and try to education the prevention portion of it. And if that doesn't work, then I think we either have police, liquor commission, and even the fire department would get involved with enforcement actions, anything that came under their regulations. So what I'm getting at, it's been a collaborative effort, and it will be continued to be. Hopefully, the new president, the new administration, we ask that money continue to support all the operations that we had, that we thought were successful, that we thought were needed to be where we are at. As we report pretty often, we say the numbers are good on Hawaii Island. We continue to think so. It's that travel related, whether it's residents coming back, specifically, sometimes a visitor coming into our island. That's what's going to keep us getting infections in the island once we get the population kind of under control. So, we'll keep doing our efforts. I'll put a plug in for the Civil Defense website, because, Lieutenant Governor's site will be good for what he puts out there and for the state information. But if you need information on exemptions, whatever is going on with Hawaii County, if you need information, definitely go to the Civil Defense website. We have call takers at our office taking information, so give us a call as well. But Civil Defense is still a place to go for Hawaii County for coronavirus.
Well, thank you so much, Talmadge and Stephen. And Talmadge, I didn't know you were on vacation. I apologize for pulling you out and bringing you into a call here. I wouldn't have bugged you, so I won't keep you much longer here. So thank you so much to Steve and Talmadge for joining us this evening and presenting, this aspect from the county. We heard from Lieutenant Governor about the state and its overarching plans and policies. we're grateful for Stephen and Talmadge to really, guide our efforts here at the county level. So thank you so much, and for being part of this call and really sharing your mana'o with us. So thank you. As we get towards the end of this meeting, I really wanted to also invite part of this effort and part of our outreach to the community to hear from those on the ground here, and especially with this vaccination effort that's going on. So we've invited ʻIwalani ʻŌhiʻa, and so I'd like to welcome her on the call now. And ʻIwalani is the Director of Risk Management here at North Hawaiʻi Hospital, Community Hospital, Queens Community Hospital here. So Director of Risk Management and Quality. And she has also been tasked as the vaccination coordinator here at our local hospital. So ʻIwalani, when we first had you on the call, the sun was still up. We really appreciate you being on the call here with us. And if you could share some last bits of information with the community about how it's going at our local hospital here with everything. Thank you so much.
Yeah, thank you for inviting me. I just want to test to make sure everyone can hear me okay.
Yes.
So we started our vaccination efforts in late December. We are a third-party clinic. We schedule all of our appointments. We do that by calling, as well as we receive emails. We are open Monday through Friday from 7 to 4. We actually were previously open till 3, but we've actually added an additional hour to accommodate our kupuna. So we have kupuna hour from 3 to 4. We also have preference for them from 7 to 9. We've been vaccinating almost 200 recipients a day. In total, we vaccinated over 3,700. We are, like Dr. Green said, we have vaccinated both phase 1A and 1B. So that's where we are now, primarily 1B. It's been a huge success, but it's also been quite a demand from the community. Not everyone is, I guess, doing the same process. Some, of course, have limitations, and so we've been able to ramp up. We'd like to ramp up more, but with the number of vaccines that come and the instability of knowing how much we'll get as far as distribution and allocation on a consistent basis, it's been difficult for us to do that. But we're very pleased with what we've done thus far, and it's worked out very well. We use the Pfizer vaccine. We do have an ultra cold freezer, so on site. So that's been, I guess, one of the things that we've been able to do as far as Pfizer, and other areas are using Moderna. I did hear Dr. Green say that, Johnson & Johnson vaccine may be coming out, but what we do is when we schedule our patients, we actually schedule them for the first and second dose. So we have scheduled out through March, and we have approximately 2,000 plus recipients that are still going to be receiving their second dose. Other than that, we have been getting a lot of really positive comments from the community, but also a lot of questions, and everyone's anxious to get their vaccine. So what we're asking is that the community be patient. It is our goal to vaccinate everyone, but again, there are limitations, and as more facilities, hospitals, clinics open up vaccination clinics, and of course the distribution will be less to go around. And so we're doing the best we can as far as to meet the immediate needs of the community. I'd be more than happy to take any questions if you have specifically about our clinic.
Yeah, we have time for the last few couple of questions. Nancy and Lani, did you have any questions that you wanted to ask of our last few guests here?
Nancy, you first, Nancy.
Okay. Thank you, ʻIwalani. Is North Hawaiʻi Community Hospital in the vaccine administration management system?
We are. We actually do in real time BAM, so that's why I know exactly how many recipients need their second dose. We've been VAMs is a requirement for the vaccine clinics. So we started entering into the VAM system. And for those that don't know, that's the Vaccine Administration Management System. And so we have in real time, our process is, we have registrars. We ask that recipients come with their picture ID, their insurance card, and we also ask them to wear masks. So we do our screening before they come in. They also have to fill out the form that Pfizer provided. Every vaccine has a vaccination information sheet, and so they fill that out. We're checking to see if they have any allergies, any other medical history that might prevent them from getting the vaccine. And we also have them wait for 15 minutes after the vaccine so that we can make sure that they don't have any reactions to the vaccine. For those who've had previous allergies or reactions to vaccine, they actually stay in our clinic for half an hour.
Good, thank you. Is there any concern about supply?
I think that's a nationwide concern, and certainly it's a concern for us because we want to continue. And, you know, like Dr. Green said earlier, the Pfizer requires dose 1 and 2. You build up your immunities for 50% after the first vaccination, and then up to 95% with the second one. So we definitely want to make sure that we can vaccinate the second dose. So it's a little bit of a challenge, but we're confident. You know, it's like someone had mentioned earlier, they're worried about people storing, but I really believe that if you don't use the vaccines, then you're not going to receive vaccines. So we definitely want to use all the vaccines we have and then, you know, just hope for the best that we'll get more allocation.
Very good, thank you. Lani?
I have a question for Mr. Magno. Talmadge, you're not giving us your Facebook connection? Nah, just kidding. But the question I have for you is about going back to regulating restaurants. There seems to be a lot, especially food servers with their mask below their nose. I think there's a lot of that going on, and there's some questions and concerns about that. So either Stephen or Talmadge, if you could please respond to that.
Yeah, I don't know if Talmadge is still on.
I'm still on. Can you hear me?
Oh, okay, go ahead, Talmadge.
Yeah. So my office, you know, we continue to take reports, and then when we get them, we'll send out the prevention and education groups, and you know, continue. You know, like I said earlier, we're into this for a year already, and I know people kind of get burned out, but we got to be reminded constantly. And the mask wearing is going to be with us for a long time. So, you know, we just ask that people, if you come into a situation where, you know, I've walked out of banks or situations where, you know, I hear people coughing, and even though they have their masks on, I leave. You gotta take your own actions to prevent yourself from getting sick. So, you know, if you don't like what you see in a particular restaurant or store, you know, you leave, come back later, report that incident, and then we'll follow up with prevention and education to follow up with that particular establishment.
Thank you. Thank you. I think that's all the questions we have, James.
It is. Well, thank you so much. And I would just really want to big mahalo to Stephen and Talmadge for the county for your efforts there. Thank you for leading the charge here. And thank you, ʻIwalani, for all of your efforts there at North Hawaiʻi Community Hospital with your vaccination team and the great work you're doing there. So thank you for all that you're doing. Really wonderful job. And thank you so much for the time this evening, Lani and Nancy. Thank you for asking our questions to our guests this evening. And if you or any of our guests are viewing this are interested in supporting Hamakua-Kohala Health, I would recommend visiting their website at Hamakua-Kohala Health, www.hamakua-health.org to learn more about them and their efforts and how you can support them. So before we close tonight's meeting, I'd like to just say a last few words, if you don't mind. So first of all, mahalo nui to all of our presenters, from Lieutenant Governor to our county representatives, and our police department here, and our February nonprofits. and our county representatives in ʻIwalani with North Hawaiʻi Community Hospital. So thank you so much once again for taking the time to update our viewers and helping to lead our community through the challenges ahead. And thank you to all of the viewers that joined us on the live stream this evening. You're welcome to revisit and rewatch this recording up on the WCA Facebook page, and we'll be up on our YouTube channel later on. Our next scheduled meeting is Thursday, March 4th, and we do hope that the mayor is in full recovery by that point, and we're able to have him join us for that evening with a number of his department heads. So we wish him a good, safe recovery, swift recovery there for him, and we look forward to having a nice conversation with him in the months ahead. So on behalf of the Waimea Community Association Board, I want to wish everyone a good health, be well, aloha.